Good afternoon, everyone, and thank you for the opportunity to present my work here. I'm working on incorporating a small molecule that has anti-scarring properties into PMMA, polymethyl methacrylate, and PEG nanofibers in order to develop anti-scarring wound dressings. And I'm coming from Canada, far away. So my specialty is in the wound healing area. When we have a wound, there's a cavity in the skin, so it has to be filled up. So the cells migrate, proliferate, and they deposit extracellular matrix component in order to fill up this gap. And it's a very, very complex process and requires an elaborate crosstalk between different cells and different materials. If we consider wound healing as a spectrum, we have normal wound healing in the middle, where the injured site goes back to its normal anatomical structure, function, and appearance within a reasonable period of time. And in the two ends, we have two pathological conditions. One is the non-healing wounds, where the wound is stuck in the inflammatory phase, and it cannot proceed to the end of wound healing process, such as diabetic foot ulcers. The second one is the skin fibrosis, where we have the exaggerated wound healing process. And we see that these conditions are clinically raised, itchy, and inelastic. And if they happen in the joints, they can limit the mobilities of the limb. And they are characterized by excessive extracellular matrix deposition, high tissue cellularity, and contracture in the extracellular matrix. So in our lab, we are trying to develop new treatments because unfortunately, the current treatments that we have right now in the clinic that range from pressure ulcers, injections of corticosteroids, up to surgical revisions, they cannot do a lot for the patients. And we still have lots of patients that face skin fibrosis or hypertrophic scars after injury to the skin. In our lab, we were able to identify a small molecule called kynurenolic acid, which is a naturally occurring molecule and is a tryptophan metabolite, as an anti-scarring agent. So I said that in the scar, we have high levels of extracellular matrix, such as collagen. And we see low levels of MMPs, which are responsible for collagen degradation. So if we want to reverse the situation, we have to reduce collagen, increase MMPs. And as you can see here, this drug can, in a dose-dependent manner, decrease collagen and increase the expression of MMPs. And also, in the scars, we see high tissue cellularity. And this drug is able to reduce the proliferation and also migration of fibroblasts. So it can act as an anti-scarring agent. And we already proved its effect in vivo in the rabbit ear model. So we put the drug in a cream and apply it every day at the back of the rabbit ear after injury. As you can see here, in the control group, we see a big bump. That is an indicator of the emergence of hypertrophic scars. And when we have the drug here, this bump goes away and we see reduced scarring. This paper is already published in PLOS ONE, and this drug is under phase 1 clinical trial to be used as an anti-scarring agent. But there's a huge problem for us to apply it in the patient. In the burn patients, or for example, in the donor site, we cannot access the wound every day. The wound is going to be dressed for like 4 days, and then the dressing is going to be changed every 4 days. And if you want to have the drug to be effective, you have to apply it and deliver it to the wound site every day. So in our lab, we tried to develop a new drug delivery system, and we came up with the new dressings. We use electrospinning process, and these are the parameters that we used. The polymer that we use is PMMA, polymethyl methacrylate. It's FDA approved, clinically used in the hip surgeries, and it's a quite hydrophobic polymer. So the water cannot penetrate the matrix. In order to open up the matrix and make it more hydrophilic so the drug can go out, we incorporated increasing concentration of PEG, and we use DMF as a solvent. This is the SCM image of the nanofibers that we were able to generate. As you can see, they are beadless, and as we increase the concentration of the PEG, the diameter of the fiber is getting smaller and smaller, and it's because the viscosity of the solution is dropping. And at 20% of the PEG, we had some problem with the spinning because the viscosity is very low. Then we looked at the hydrophilicity of the dressings that we made. As you can see, PMMA is quite hydrophobic and the contact angle is quite high. And when we increase 10% of the PEG, the hydrophobicity is reduced. And it's reflected in the amount of the water that the PBS that the dressing can retain. It's very important for us because in the wound, a good dressing should be able to balance the moisture of the wound, and also the dressing should be wet so it can release the drug. And as you can see here, in the 10%, we have up to 300 increase in the weight. Then we looked at the release profile. We are looking for a dressing that can release the drug in a controlled fashion in a period like 4 days, so it can slowly release the drug and we don't have to apply the drug every day. As you can see, as we are increasing the concentration of the PEG, the amount of the drug release is increased, and we have lower control over the release. And as you can see, at 10% and 20%, we lost the control over the release, and most of the drug is released in the burst release fashion in the first 8 hours. But we have to keep in mind, in the wound, we are not facing this situation. This is the total immersion setting. In the wound, we don't have that much of exudate. So we designed another study to have a more realistic design release profile. We use a 2-chamber well. We put the dressing on top, hydrogel to keep it moist, and we added PBS just to touch the filter. So this is more realistic and it resembles the wound. And as you can see, the lowest line is the PMMA plus 5%, and as we go up, we see more increase in the release, but it's not like here that we have burst release in 10 and 20%. And actually, we decided to use 10% as a lead formulation for the delivery of the drug. After we incorporated the drug into the nanofibers, we have to make sure that the drug is still active. And also, we have to make sure that these dressings are safe. So we designed this study again, that we cultured dermal fibroblasts in the lower chamber. We added up with the media and we put the dressing on top, and we looked at the cell proliferation and also cell viability as the indicators of cytocompatibility of the dressing. As you can see in the panel C, we don't see that much of cell death. So it shows that the dressing is actually safe and it doesn't cause cell death for us. And in our first study, we showed that kynurenolic acid is able to reduce proliferation of fibroblasts. So in future, when we apply it on the animal, it will be able to reduce cellularity, and it can act as the anti-scarring. And as you can see, when we have kynurenolic acid, either doped directly into the media or delivered through nanofibers, we see reduction in the fibroblasts. This is the first indication that the release drug from the nanofibers is still active. In the second step, we looked at the effect of the release drug on the expression of extracellular matrix. As we expected, when we have kynurenolic acid delivered by the nanofibers, we see reduction in the collagen type 1 and increase in the MMP1. So it shows that the drug, even we processed it and we put it in nanofibers, it keeps its activity. At the last step, we wanted to show that our dressings are effective. So we made 4 full thickness wounds at the back of the rats, and we started the treatment. We dressed the wounds with nanofibers alone, or nanofibers that release kynurenine. These dressings were changed every day. This is the thing that we are using, and we are gonna use it in the clinic. And we also used a cream that has kynurenolic acid, and the cream was applied daily. So the rationale was to see that whether these dressings have the same effectiveness as the daily application of the cream. As you can see here in the H&E pictures, we see less cellularity in the last 2 panels compared to the control or nanofiber treated wounds. So it shows that we are reducing the characteristics of a scarring. And also, when we did the qPCR and looked at the gene expression, we saw that these dressings, nanofiber plus kynurenine, and the last one, which is the kynurenine plus cream, they can increase the expression of MMPs and decrease the expression of collagen type 1. So these dressings are also active in vivo. So as the conclusion, we were able to develop a new drug delivery system for this small molecule, and it's based on PMMA plus 10% PEG. And these nanofibers can deliver the drug, and the released drug is effective to modulate the expression of ECM components both in vivo and in vitro. And we believe the application of these dressings in burn patients or patients that go under surgery and they are prone to develop hypertrophic scars, these dressings will be able to prevent the emergence of this condition. Thank you so much.
Any question? I have one question,
Okay.
if you don't mind. As you mentioned that if viscosity is increasing, percentage of PEG is increasing.
Viscosity
you said that the
decreases.
fiber diameter is decreasing.
Yes.
But normally viscosity increases.
No, viscosity decreases.
Okay, viscosity decreasing, that's why it is
Yes, because we are using a low molecular weight PEG.
low. Okay.
Thank you.